Hello everyone, welcome to the first podcast of Apeksha Hospital, Dibrugarh. They say that the first step towards bringing about a revolutionary change is daring to dream big. So today we have with us none other than Dr. Ashok Agarwal, who dared to dream big and bring about a world-class hospital at the vicinity of our very own Dibrugarh. Today, we are going to talk about a topic which is very relevant in today's time, but unfortunately, people don't really come forward. Maybe it's a taboo topic, maybe they are not comfortable because of the personal touch that this topic has. So we thought, why not bring it to you ourselves? So, hello Dr. Ashok.
Hello.
So, as we have chosen today's topic of IVF, the first thing that I would like to really ask, and many of our audiences would also like to know, why is it that the prevalence of infertility is so much there in today's scenario, which was unseen earlier? So what could be the possible reason for that?
The current scenario in terms of infertility is gift of our modernization.
Right.
Number one, the couple is career focused.
Yes.
They usually go for late marriage. Then comes the lifestyle, lack of exercises, too much of stress, too much of screen time, too much of pollutants in the environment, and most importantly, we have lost the happiness of life. Whatever we are doing is mechanical in the current scenario, and these reasons, they directly or indirectly affect fertility of both male as well as female.
So today's lifestyle, you are saying, is one of the most important factor.
Yes.
So what does lifestyle mean here? Is it food habits? Is it?
Yeah,
is
it's
it
a combination of so many things. Number one is in the current scenario, mostly we are devoid of physical activities, exercises.
Yes.
We have adapted to more or less a sedentary lifestyle.
Yes.
We are more giving, focused on our screens, our mobiles, our internet connections, but not anything which is physical.
Right.
This is the key factor in the current scenario which is operating, along with late marriage, which is a very, very important factor.
Okay.
Because we are giving so much time to build up our future that by that time your ovaries are aged, your testes are aged, and the sperm function and egg function, they compromise a lot. The uterus which harbors the pregnancy, it becomes the seed of disease by that time when you start planning the pregnancy.
Alright.
So you are too late to begin with. Your beginning is late because you are focused on other stuffs, not on the primary thing.
Yes. Since you have now spoken about late marriages, now this is a very a topic which is debatable, because what exactly is the right age then? If you talk about late marriage, then what is the right marriage age first of all? Or is it possible to, like nowadays, people freeze their eggs or something like that?
Yes. See, the fertility potential of a woman starts declining tremendously after the age of 35.
Okay.
If you compare three barriers, one is 35, one is 37, one is 40.
Mm-hmm.
The fertility potential below 35 is good.
Mm-hmm.
There is a significant decrease at the age of 35, and beyond 35, it starts decreasing like anything.
Okay.
35 to 37 is still the Indian woman, they have good potential, but 37 onwards, the potential goes very badly.
Alright.
Yes, the point that if a woman is going for late marriage, Tetya, you can store your eggs, that is true, but again that is a process of IVF. This will not give you a natural conception.
Mm-hmm.
You will be getting pregnancy only through IVF, and what I consider is you are missing some joy of your motherhood which you should be getting.
Okay. Alright.
That is the main thing. And after 40, yes, some very lucky patients are pregnant naturally, mostly they need some or other form of help by artificial reproductive technology.
Okay. So when we talk about IVF, what exactly is IVF? How do people approach to go ahead with it? Is it, is it too costly in terms of the general public? So if you can just first of all let us know what exactly consists of IVF.
See, there are few important things which people have to understand. Eto buji paboi lagibo IVF or এটা আমার কমন ধাৰণা আছে যে ঠিক আছে একো নহলে IVF কৰি লওঁ IVF or কেইটামান ইণ্ডিকেশ্যন আছে তাৰ ভিতৰত সবতকৈ যেটো ইম্পৰ্টেণ্ট ইণ্ডিকেশ্যন হয় এটো হয় যদি if in your gynecological system your fallopian tubes are damaged beyond repair যদি আপোনাৰ fallopian tube কেটা এনেকুৱাকৈ ড্যামেজ হৈছে যেটো আপুনি ন্যাচুৰাল কনসেপশনৰ কথা ভাবিবই নোৱাৰে that becomes a number one indication for IVF whether the couple is a young couple or a middle aged or a late aged. Then comes the duration of infertility.
Correct.
Jadi a couple is having a long duration of infertility, they have tried the smaller procedures, they have tried natural conception way, but it has not become successful, then that becomes an indication for IVF. Then there are some special indications of IVF where even the couple is married very recently, but the ovarian reserve of the woman is compromised. In those scenarios also, we always want that you should conceive fast, because if we are delaying your fertility, then your ovarian compromise will still be higher. So these are few indications where we advise usually to the couple that you go for IVF. Now the process of IVF, broadly speaking, our pregnancy hobole we need sperms from husband's side, which can be derived from husband's semen or directly from the testicles. There are techniques. From wife side we need eggs, we need ovum. For that usually the process starts from day 2 or day 3 of menstrual cycle. Usually the patient is given some form of hormonal stimulations. There are various protocols. Once those stimulations are given on an average ranging from 10 to 15 days time, the ovaries are prepared with the eggs through an artificial process called ovum pickup. Ami patient ok anesthesia diu for a short time. Hospital stay is not there. The couple has to stay in the hospital for 2 to 3 hours. Under anesthesia eggs keta ami uliyai lo, and then the patient can return home the same day without having an indoor admission in the hospital. Those eggs and the sperms collected from husband are handed over to the embryologist. Then comes the role of the embryologist. The embryologist will do fertilization of the eggs and the sperms. There are various techniques which are being used in this. Sometimes we go for natural in vitro fertilization in the lab. Sometimes there is a special technique which is called ICSI, where the sperms are directly injected in the egg to produce the embryo. Ekita technique within a period of 3 to 4 days your embryogenesis is complete.
Okay.
Once embryo formation is complete, now the embryologist is ready with the embryos. Now it's on the part of the clinician, the doctor, to decide when to transfer those embryos to the woman's womb again. Je ami etu ketia transfer korim. Etia jitu current day scenario ase, ei current day scenario ki hoy, usually the technique of all freeze is preferred. Jiman keta embryo formation hoy, ei embryo keta ajikali technique ase called vitrification. Ei vitrification technique di use kori pine ei embryo keta freeze kori dia hoy. Now those embryos form become the property of the couple. Suppose a patient has undergone IVF stimulation, husband semen is taking, the embryologist has prepared X number of embryos.
Yes.
Now there are two options. Some centers in the world they go for fresh transfer as well as frozen transfer. Some centers they prefer only all freeze embryos technique, where once the embryos are made, then the couple is free from that cycle. Then after giving a gap of 1, 2, 3 cycles depending on the preparation of the uterus, depending on the preparation of the couple, depending on their social suitability, depending on their travel plans, depending on their holiday plans, depending on their vacation, they can choose the time when they can again replace those embryos inside the womb.
Okay.
And if those embryos, usually we give again a choice to the couple that how many number of embryos the couple wants. Worldwide, the best of the centers, they always say that you go for a single embryo transfer, which is called a blastocyst transfer, one at a time. Because if we give multiple number of embryos to the patient, the chances of multiple order pregnancies comes. Those pregnancies, as the number of fetuses increases inside the womb, they have a higher complication rate. এই প্রেগনেন্সিজ কেটা আপোনাৰ খালি প্রেগনেন্সি হলে নহব, এই প্রেগনেন্সি আউটকামটো ভাল হ'ব লাগিব, there has to be a take home baby rate.
Yes.
A take home baby rate is highest with singleton pregnancy, a bit lesser with twin pregnancy. More than twin pregnancy in current day scenario is not justified, ideally.
Yes.
Sorry. Now, some couples, they give the choice that we want multiple embryos to be transferred কারণ আমার সাকসেস রেটটো বেছি হ'ব লাগে, কারণ যিমানটো নাম্বাৰ অফ এম্ব্ৰিয়জ আমি বেছিকৈ ট্ৰান্সফাৰ কৰিম সেই পেচেণ্টৰ প্ৰেগনেঞ্চি হোৱা চান্সটো বাঢ়িব। কিন্তু আমি সদায় পেচেণ্টক এইটো এক্সপ্লেইন কৰোঁ যে আপোনাৰ ৰিস্ক ফেক্টৰো বাঢ়ি যায়। ইফ দি couple understands ready to transfer one embryo is good, highest 2 embryos, beyond that in the current medical scenario is not justified. Sometimes even 2 number of embryos can divide, sometimes still higher number of pregnancies can be achieved, even triplet. Ajikali eta technique available ase which is called embryo reduction. A embryo reduction technique di যদি number of embryos basically grow করে, then with a very small procedure, again a OPD procedure, number of embryos can be minimized according to the couple's choice. Suppose the patient has conceived twin pregnancy,
Yes.
and they want a single pregnancy to be continued, then that twin pregnancy can be converted into a single pregnancy.
Okay.
Earlier days, say around 5 years from now, the technique of IVF, the process of giving injections, the process of taking out the eggs, the process of formation of embryo, the process of freezing the embryos was very complicated. But nowadays, with the availability of modern techniques, the process has become very easy. Once upon a time, we used to follow a technique called down regulation, jote 20 din, 25 din patient injection loi thakibo lage. Jitu ajikali cut short kori pine 10 din, 12 din averagely ahi goise, with a very good success rate of around 50 to 60%. See, IVF, there is a play between the embryo and the uterus. That means the seed and the soil. However good the seed is, however good the uterine behavior is, still if the interaction is not good because of variety of factors, it will end up into failure. Even the best of the best centers in the world, if you find their average success rate on a true data basis,
Yes.
on the randomized controlled trials, then you will find they report their highest success rate between 60 to 70%.
Okay.
But on an average, the take home baby rate with these modern techniques is around 50% per cycle. এইটো বস্তু যেটা কনফিউজন হয় যে 10টা পেশেন্ট যদি সাপোজ দে আন্ডারগো এমব্রিও ট্রান্সফার 5টাই প্রেগনেন্ট হ'ব, ইয়েস রাইট, কিন্তু যেটো 5টা পেশেন্ট থাকি গ'ল, এইকেইটা পেশেন্টক যদি আমাৰ ওচৰত এমব্ৰিও আছে তেওঁলোকৰ ফ্ৰী, এগেইন ইফ দে আৰ বিং ট্ৰান্সফাৰ্ড উইথ দ্য এমব্ৰিওজ, এগেইন দে হ্যাভ আ সাকসেস রেট অফ 50%. সো সে আই এম গিভিং ইউ ওয়ান এক্সাম্পল, 5টা পেশেন্ট ফেইলাৰ হ'ল, এইকেইটা 5টা পেশেন্টক আমি আকৌ এমব্ৰিও ট্ৰান্সফাৰ কৰিলোঁ, তাৰ পৰা আকৌ 2 or 3 পেশেন্টস উইল বি প্ৰেগনেন্ট। যিকেইটা পেশেন্ট দুটা থাকি গ'ল তেওঁলোকক যদি আকৌ এই এমব্ৰিওজ কেইটা আছে আকৌ যদি ট্ৰান্সফাৰ কৰা হ'ল, দেন এগেইন maybe one patient is pregnant. That means you can say if a couple is genuinely getting 3 attempts of embryo transfer, their cumulative success rate is around 80 to 90%, which is a very good success rate.
Right.
But again, that depends on the medical general and surgical conditions of the patient.
Yes. You brought up a very important insight here, that no matter how good the seed is, the soil has to be equally good. Now, when you talk about this part, what kind of health factors are we talking about here? If you can just
See, usually pre-IVF, if a patient is coming to you, doctor, I want to go for IVF, I am in hurry. We always counsel the patient that don't be in hurry. Take some time, prepare yourself. If the lady is obese, if the couple, say even husband also, we always tell them, you do some physical activity, do some dieting, do some exercises, go for weight loss, prepare yourself, because it is seen that in an obese woman, even 10% body weight loss, it increases your success rate like anything.
Okay.
We are seeing in the practical experience that a couple who is coming to you for IVF, give them 3 months time, counsel them well, ask them to reduce some weight.
Yes.
You will see the couple is not coming for IVF. 10-20% of such couples will come to you within 3 months with pregnancy. This works so wonders. Yes. Yes. Then there comes the role of lifestyle. Doing some yoga, doing some meditation, doing some mental health exercises, having a stress-free period, going for a holiday, not talking about your fertility issues, getting some supplements to improve the quality of your eggs, having good nutrition, having good sleep, not to be burdened with the other stresses of life, like your work environment, like your family pressure, like your financial issues. So those things, they work wonders. The center who produced the first IVF baby of the world, they usually now recommend at least 6 weeks of yoga, meditation, the Indian version of exercises to their couples inside their campus to improve their success rates. This is the truth. Yes, the things which were Indians are now being practiced by the Europeans and the outside world, and it's unfortunate that we being Indians, we are forgetting our ancient art of
we
healing.
have now adopted the sedentary lifestyle with no movements.
True.
So we have to go back to our roots even for success in terms of fertility. Wow, that's great. You also spoke about issues like you spoke about, that sometimes they have to go through a longer cycle if there is no success rate, and you might also have to give them anesthesia. So what kind of anesthesia are we talking about here?
Here, the intervention in the current day IVF is very, very minimal nowadays.
Yes.
The type of anesthesia the lady in the IVF cycle gets only once, that is for ovum pickup.
Okay.
And that is a procedure max 5 minutes.
5 minutes.
Yes, and that is a very short form of anesthesia, so that the patient becomes comfortable. Within 2 hours, if the patient goes home with the procedure, usually the patient can assume all her normal activities and normal diet. Usually there are no restrictions related to the procedure.
Okay.
So it is with that minimum intervention in the current scenario.
Okay. So you also spoke about fresh and frozen.
Yes. Yes.
So in that case, as a doctor, what kind of success rate do you see in which?
See, there is a
more
grossly
success?
difference of success rate in the frozen embryo cycle, because there is reason for it. When you are going for embryo transfer in the same cycle, jitu cycle ot apnak stimulate kori pine dimbanu keta bahirot ulwa hoise, apnar hormonal profile to altered thake. Apunar stimulation or karone bahut khini hormones use kora hoy, apnar uterus or receptivity of 5 to 10% lower side ot thake, komi jay. কিন্তু যেতিয়া আপনি ফ্রোজেন এমব্রিও ট্রান্সফার সাইকেলত যাব, হেতু সাইকেলত আপনাক প্রিপারেশন ভালকে কৰা হয়, uterus is more prepared to receive the embryo as compared to the hormonal disturbance which was there in your stimulated cycle.
Okay.
But there are some ifs and buts. There are 2 sides of the coins here. Sometimes, unfortunately, if we are trying to do vitrification for the patient, and when the patient is again ready for the frozen embryo transfers, and when there is a process called thawing, when we again prepare those embryos, sometimes there is embryo loss, sometimes the embryo shows some quality changes, sometimes there is some damage to the embryos. So again that becomes a dilemma. That's why this is a clinician's decision along with the embryology team that how good the embryos are when the embryos are prepared and when they are undergoing the process of freezing. So usually if we find the number of embryos are high and if the couple is ready with counseling, then if you are having a bank reserve of freezing the embryos, then sometimes we give the option to the couple that say 1 or 2 embryo you can get transferred in the fresh cycle as well. If it will end up in a failure, you are not going to lose anything because you have good reserve. The dilemma comes when you have very limited number of embryos, then if you are losing those embryos by doing a fresh embryo transfer, you have nothing to retransfer, then yes, frozen embryo transfer becomes the first choice for the couple.
Alright, great. Another thing which most people wanted to know was, like, after an embryo transfer, what kind of lifestyle changes is it required? Do they need to take rest all the time, or is it a normal lifestyle they can have?
The scientific evidence after the embryo transfer, it says that 15 minutes rest after embryo transfer in the supine position is usually great enough to give you a pregnancy. After that, if you are assuming your normal lifestyle, your normal day-to-day work, usually it doesn't alter your success rate. In most of the European countries, if you go for an embryo transfer and then you submit your vacation leave to the institute where you are working, they say it's non-scientific because the data doesn't support it. But yes, since the couple goes for a lot of pain, lot of agony, lot of financial burden, lot of painful procedures at times, the kind of mental stress, we usually at our Indian centers, we recommend that you can resume your normal day-to-day lifestyle. Try to avoid those things which you can avoid. Say, in terms, we always advise the patient, try to minimize travel if you can. Try to avoid heavy work, weightlifting if you can. Try to do some relaxation, don't be engaged in over strenuous activities. These are the usual things which we recommend to the couple after an embryo transfer. Absolute bed rest, don't move out, don't work in your kitchen, don't work in your office, don't be there with your laptop works. This is not the scientific choice.
So not too much straining or not too much travel, otherwise regular work they can resume very easily. Since you brought up the topic of the pain part of it, now this is something that I'm sure most people want to know, that is it a really painful process?